Well, public education and awareness is integral to the development of society. And this morning, AM Prime is pleased to welcome the Children's Authority to our program, where Ms. Anjuli Tewari de Fague, the team leader of the foster care unit at the Children's Authority, joins us to speak about Kinship Foster Care. Good morning, Ms. de Fague.
Good morning. Thank you so much for having us here today.
Well, thank you very much for joining me. Could we just start by explaining to our viewers precisely what is Kinship Foster Care?
Okay, sure, no problem. What I'd actually like to start with is explaining what foster care is, so that I can give you the context of where Kinship Foster Care lies. So foster care has existed in Trinidad and Tobago since the early 90s, and it's actually a program where temporary care is offered to children who cannot stay within their families for a variety of reasons. And generally that system, which we've established since 2015, with regards to the operationalization of the Children's Authority, we have established approved foster care providers where children can stay with our foster care providers. And these are usually volunteers, people who do not know these children, but they have great love in their hearts, safe homes, and that environment to provide those children with care. Now, Kinship Foster Care is actually where the authority provides support to relatives to provide care to their children. So rather than remove a child from their home, which can be very traumatic, we are seeking assistance from relatives to actually care for their children whilst we work in the background with their families, with their parents, so children can eventually return, but in the meantime, their basic needs are being met.
But why is Kinship Foster Care so important? Why is this an option that the authority is looking at, especially in terms of the support?
So in general, family settings are really good for children to grow up in. Whilst we have relied for many, many years on institutions, internationally, we're moving away from institutions because we realize that children develop better, they prosper better, they get more one-to-one attention in that family environment. And with Kinship Foster Care, we are expanding our placement options. So rather than just the children's homes, rather than just general foster care, we are now focusing more and sort of formalizing that family arrangement. So when I say relative, though, I want to be very clear. Relative is currently defined by the legislation, which is Section 3 of the Children's Authority Act, as step-parent, grandparent, brother, sister, uncle, aunt, whether it's whole blood or half blood. So at this point in time, we do have a strict definition as to who qualifies as relative. And when we say support, we are giving that sort of psychosocial support, that training, that financial support in order to meet the needs of the child.
This training that you mentioned, we can expand on psychosocial in a moment, but this training that you mentioned, exactly what does that entail? What would that require?
Sure. What we realize, and we offer this training to our regular foster parents as well, a lot of people are coming to the system with various experiences. Some may have been parents already, some may have cared for children in some various aspect, whether it's nieces, nephews, babysitting. But what we're trying to give persons is a general understanding of parenting and what they will be responsible for. So we will be dealing with topics such as child development, child protection, child safety, basic medical care for a child within the home, sort of looking at anger management, looking at those basic things that a parent would need in order to treat with a child in their care.
And this psychosocial support, that extends to the child as well as the relatives, or is that solely for the relatives?
Absolutely. So when a child comes into care, our team doesn't just place the child and leave. We are creating a team around the child. So we are not only providing support and monitoring to the child, but we're also providing support to the adult, the parents in the home, because we really feel as though sometimes a lot of our children are coming with additional issues. And we do want to give those parents those tools in order to properly treat with the child's needs. So we do give them that counseling, we do give them that mediation, we do give them that respite where necessary.
But you also mentioned financial support. The Children's Authority provides financial support for Kinship Foster Care?
Yep. So just to really make it clear, because we don't want persons doing this just for the money. When you become a foster parent in general, whether it's Kinship Foster Care or regular foster care, when we do our assessment and thorough vetting to ensure that you meet our criteria, we do ensure that financially you can meet your own needs. So you're paying your own bills, you're paying your own rent or mortgage. So when we give you a stipend, it's specifically for the needs of the child. And we would continue to monitor this when we come to see the child in home visits, school visits, when we do supervised access with their parents. So we are checking in. So we really do want to make sure the persons aren't going to abuse the system.
Well, hope so. Stringent tests and stringent measures are in place. I mean, it's a very valuable program, but of course, we don't want people taking advantage of it, as you just mentioned. Why would a child need kinship foster care, though?
So we do want to, in Trinidad and Tobago, I feel every day we see headlines where children are being removed from their homes due to a variety of reasons. You know, whether it's abuse, psychological, emotional, physical, sexual, whether it's neglect. It could be because a parent has mental health issues or the child has mental health issues. It could be because a parent is incarcerated or using drugs, or it could very well be that a child's parents have died and no relative has come forward, and we have no other choice but to actually place our child in care. What we are doing now in formalizing the system, we're really appealing to families. If you do have a child in the system and you are willing and able to care for this child, come forward. Let us engage in that conversation with you to see if you meet our criteria. Let us do those safety checks to make sure that we're removing a child from a space of danger. We're placing them in a safe space as well. That's really important. That vetting that we do of our regular and our kinship foster parents is really important. And then when you come forward, we can determine whether you can be approved.
Now, when you said regular vetting, is there a certain set standard in terms of, well, we have to vet every 3 months, we have to do these tests every 3 months? Is there a certain timeline?
So before you actually become a kinship foster parent, you do have to be approved. So this is a formalized vetting process where we come into the home, we do a home assessment, we speak to all persons within the home, whether they be adults or children. We do background checks, we speak to the community, we do reference checks. So we are checking as far as possible. We even ask all adults in the home to supply police certificates of character. We're not trying to make it difficult, but we are trying to go above and beyond to determine whether this home is a safe space, especially if a child has previously been exposed to trauma.
I know. Sorry, go ahead, continue.
Just one more thing. Sorry. So, and also you said how regular. Once you become approved, so that's a process that we take before our board to be approved, we do then regularly check in on the child and the foster parent. And that's not because we're spying or we're trying to make things difficult. We are trying to support you. Like I said previously, we're doing home visits, school visits, we're doing check-ins, we're assisting if a child needs to go to medical or counseling. Whilst that is one of the responsibilities of the foster parent, if it's difficult, we will try our best to see how we can support.
Well, following the COVID-19 pandemic, has the authority seen an increase in kinship foster care, by extension foster care?
So we are now formalizing kinship foster care. When the pandemic started, we did get a big rush of persons who were interested in foster care. But I would say now that sort of reality has set in post-pandemic, persons do have responsibilities. They do have commitments. They do have their 8 to 4 jobs. They have school runs. They have traffic to deal with. But foster care is a really meaningful, fulfilling experience. We do encourage those persons who do have that desire to care for children to really come forward, in spite of those other responsibilities. If you're passionate enough, we do encourage you to consider foster care. With regards to children in need of placement, absolutely. Since the pandemic, that need for placement in Trinidad and Tobago has increased. And we have experienced, unfortunately, a placement crisis per se. There are not enough spaces for children in our current placement options. So that includes our children's homes, and that also includes our regular foster parents. As soon as we approve a foster parent, generally, we are able to place a child. And that's why we really are asking the nation, if it is that you do have a child that's in care and you are a relative of that child, and you're willing and able, come forward, help us not have to place that child in a home. Help us not have to place that child in an institution. Let us see if we can place our child with a relative where possible, appropriate, and in the best interest of the child.
Now, I know you said that kinship foster care arrangements are being formalized by the authority, but is there any idea as to limits as it relates to a child per relative or per relatives or a child per household under the program?
Pardon, sorry, I didn't hear that last part of the question.
Are there a limit to the number of children that can be allocated towards, when I say allocated, I mean in terms of relatives to child?
So once it is that you come to us, we do investigations into the capacity of your home, your support network. So you can be a single foster parent, but if it is that your home is large enough, or if it is that your support network, and when I say support network, raising a child is a difficult task. Everyone knows this. It's a big commitment. It's a big responsibility. And we do ask persons to establish a good support network, whether this is relatives, whether this is your church, neighbors, close friends, persons who can assist you in times of need, whether it's an emergency, a medical emergency, a school emergency, those people you rely on. So when we're looking at the number of children who can be placed with a foster parent, it really is determined by your capacity and your support. Also, if it is that, for example, with kinship foster care, if we're looking at groups of siblings, we really do try not to split siblings up unless we have to, but sometimes out of dire need, we're not able to place those larger groups of siblings. So we do have to split them up, but if we do split them up into different homes, we try our best to continue having visits so they don't lose those existing bonds.
Now, we start off this conversation by you actually giving a brief definition as per what foster care is, and then expanding on what kinship foster care is. But I'm curious, are there different types or different categories of kinship foster care?
So I'll swap that question a little bit. There's different types of regular foster care. But with regards to kinship foster care, it really is determined and guided by the fact that you have to have a child, the relative has to have a child within the system. Mm-hmm. You can't become a kinship foster care unless one of your relatives, meaning a child, is already in the system or is coming into the system. So whereas with regular foster care, where these are volunteer strangers, there are different types of foster care. And that would be, we can do short-term foster care, where it's just for a brief period while we continue to do work in the background with families. Longer-term foster care, where sometimes a child stays in that foster parent's care till they age out, depending on the circumstances. There's emergency foster care, if it is that we get a call late at night and a child needs to be placed in a home for a very brief period. Or there's also respite foster care, where a foster parent, if they need to travel or go abroad, we would actually place that child with another foster parent temporarily until they return, as well as specialized foster care, which deals with children with special needs. So whereas kinship foster care would be able to lean into the specialist foster care and respite foster care, specifically in order to qualify to become a kinship foster parent, you have to have a child within the system.
Now, the next side of it is if in the unfortunate incident a child has to be removed from the relative, is it that then they are immediately placed into a foster home until another foster carer or caregiver can be found?
Yes. So sometimes, and the truth is, sometimes placement don't work out. We try our best to support where possible, but if it is that there is a placement breakdown, our next option would be to place that child with an alternative foster parent. It may not be a relative, but this time we would look at regular foster care. And if there's no appropriate spaces, we would have to then rely on our children's homes.
And what are the benefits of foster care, especially as it relates to the community?
So I would say foster care really gives that sense of family to a child. Whereas, and this is in no way or means meant to knock the children's homes in Trinidad and Tobago, because they have been trying their best to really do as much as they can with the limited resources that they have. Really and truly, a child growing up in a large institution is different from a child growing up in a family setting with maybe a mother or a father or both, or even with that extended family. You get that one-to-one care, so really and truly, we're trying to sort of develop that sense of family, because when that child leaves care, whether it's when they age out at the age of 18 or even before, we really want to prepare children for sort of real situations. And like I said, not in any way meant to knock the children's homes, but really and truly, we're trying to move away from those large institutions and have more individualized care for children.
Moving away from those institutions, a public awareness information campaign. I know this is part of it, but does the authority plan on expanding and going further, perhaps into communities, to help educate the public and bring awareness to the situation and notify, listen, you can help, you can raise a child and you can give a child a home or a family?
Sure, absolutely. So, like I said, we are now currently formalizing Kinship Foster Care, but we do hope to roll out our sort of I want to say recruitment campaign, but when I say recruitment campaign, our sensitization of Kinship Foster Care, making persons aware, and that would be via networks such as yours, whether they're groups who want us to come forward and sort of speak. We are going to go into communities. We are going to do sort of different strategies to get the word out into those communities, especially when we zoom out and look at the areas in Trinidad and Tobago that have high cases of children needing to be placed. So we are looking and exploring at those methods. We're going to do a lot of social media. We're going to do a lot of talks on Kinship Foster Care to raise awareness. We're hoping that at one point, foster care and Kinship Foster Care become normal household words. They become normal household practices where when people want to give back, when they want to open their hearts and homes, they think, well, maybe foster care is something I consider. Or maybe there's somebody I know who has a lot of time on their hands, who's available, who's willing, who has a lot of love to give. Maybe they would be a good foster parent.
Now, the authority is expanding its support and its support systems, but does the authority in itself have the support or that is necessary or required to ensure that it carries out its duties and responsibilities?
So like many other social agencies, we are sometimes strapped for resources, but we are passionate about what we do, and we will try our best to meet the needs of the nation with the resources that we have. And we are getting the support to advocate for and to roll out Kinship Foster Care.
Ms. Anjuli Tewari, thank you very much for joining me on AM Prime this morning. Certainly has been a pleasure, and we're all a bit more informed and educated, and we thank the authority for their work, and we extend our support to them as we try to make Trinidad and Tobago a home for all. Let's put it that way. Thank you very much.
Thank you very much.